Day today, and today we saw and we've been reading about the news of the burial of the funeral service of Kenzani Maseko, who died, who took her life at the weekend, and she's believed to have suffered from depression. Now, depression is something that affects all of us, men and women, but what does seem to be true is that women seem to seek assistance and help more than men do. So to help us look at this issue of depression, I'm now joined by Dr. Shaheda Omar from the Teddy Bear Clinic. Thanks so much for joining us. Welcome to the program. More and more we hear stories in the news, people taking their lives, and depression is often cited in the midst of some of this grief. And I just wonder, you know, when we look at it, first of all, I guess, let's try and define it. What's the difference between clinical depression and just being sad or unhappy?
Okay, so I think there are three differences here we need to look at: clinical depression, sadness, and depression. Clinical depression, of course, we're looking at chemical imbalances in the system. It's endogenous, and of course, it can be treated provided help is sought by a medical professional, a psychiatrist, clinical psychologist, where medication is prescribed and psychotherapy is provided. So that is something that can be addressed, and people can continue to live a healthy, favorable, emotionally stable life, provided they are compliant. With sadness, we know that from time to time there are, of course, situations, incidences that trigger sadness, where one could feel a sense of low, a sense of unhappiness, sometimes feeling weepy, a little bit out of control. It's not persistent and prevalent in one's life, where the pattern is not pervasive in every aspect or sphere of life. Depression, of course, is more pervasive. It's quite extensive. It intrudes and invades on people's overall daily life activities, their operational functioning, where they find themselves in a situation they cannot concentrate. They feel trapped. They feel immobilized. There's this lack of energy, lethargy, the sense of hopelessness, helplessness, almost as if there's no way out of the situation, this doom and gloom. And as I said, I think we need to look at the frequency, the duration, and the severity. And with depression, obviously, we find that it is frequent, and the duration, where the actual periods are very lengthy, and the severity is extensive. It's actually invading the person's whole sphere of thinking, feeling, acting, where they can, it affects their mood levels. There's irritability, anger outbursts, where they, for no reason, or they become aggressive. There's no interest in things that they've had previously, sometimes changes in their sleeping patterns or eating patterns. And we can continue, but these are just some of the glaring symptoms that persons with depression would manifest.
And I would imagine that there are different types of depressions. Indeed. And some that are unique to women. I think about postpartum and perhaps...
okay, so absolutely. We need to look at your premenstrual dysphoric disorder with the the menstrual cycle, where people will manifest symptoms. Then, as you've said, during depression, where people with the pre-diagnosis of depression could manifest and experience depression during pregnancy, which could also be administered with psychotherapy and medication, or changes of medication. But then even your postpartum, where the first 12 days one could experience symptoms of depression, but it becomes a major depressive disorder if it exceeds that period and it continues to pervade in one's life. And then, of course, the menopause, where so many women are plagued by this, and we find that the sudden outbursts of aggression, the hot flashes, the irritability, the lack of the insomnia, which is quite prevalent and something that one needs to look out for. But all of these can be treated. People can continue to live a healthy, positive, and active life and be productive as individuals.
I suppose as society we need to kind of change our thinking and dealing of mental health? Because, you know, a lot of the times people just say, pull yourself together, man, you know, but it is a real illness and needs to be treated like one.
And I think that what you've highlighted is so important. It is real. It needs to be recognized. It needs to be appreciated and understood more frequently by everybody out there. Because for the person in that situation, it's just doom and gloom. It's hopelessness. It's helplessness. It's feeling totally out of control, powerless, and feeling that no support or no help in the world can actually help that individual or make a difference. And I think what we are finding, we seem to be labeling, or that the leaning is toward that this is a female disorder. In actual fact, it is not. We know that 1 in 4 women in their lifespan have experienced some or other form of depression, and 2/3 of women are likely to be diagnosed with depression. However, we know that a lot more males are experiencing depression, and there's this myth and misperception that you know, men are not allowed to experience this disorder, because if we look at our socialization, the culture of patriarchy, you know, where men are not allowed to come forward. With women, what we actually see, your suicidal ideations, your suicidal thoughts, the actual attempts that they make. So they internalize, where they will even self-cut, the self-mutilation. But with men, suddenly you just say boom, bang, and there's a suicide that has been committed because they externalize.
Yeah. Unfortunately, we run out of time, but very briefly, like less than 30 seconds, if you could just tell us, what are the signs that we should look out for if people around us are probably suffering from depression and they don't realize it, and we need to help them?
So I think some things that we see, people that took interest or enjoyed activities before suddenly lose interest. They've lost their attention span, inability to concentrate, or that loss of appetite, or even eating far too much, or even changes in the sleeping patterns. But even people that actually previously took pride in their appearance no longer take pride, and that constant exhaustion of fatigue, or look, you know, that far away look, that vacant stare, and you know, the irritability and aggressive outbursts. Because if you unpack those layers of anger, aggression, there's deep sadness, and that is something that we need to look at.
Dr. Shaheda, thank you so much. We always appreciate your coming through to share your insights with us. Thank you so much indeed talking to us on this important subject.
And to all women out there, stay awesome, stay as wonderful as you are. What do they say? Watinti Bafazi, Watinti Mbokodo.
There you go. Dr. Shaheda Omar from the Teddy Bear Clinic. And that's where we're going to leave it for the time being. But let's move on.